Please welcome from Iowa Department of Health and Human Services, George Walton.
Good morning, everyone. Welcome to day 3 of STI Engage. I'm so glad to see you all made it out this morning. I can mostly see you despite the lights. Hope everyone had a great time thus far. Enjoyed the festivities last night. For those of you who weren't able to make it, I'll say you missed a lot. It was great to see a new rendition of It's Raining Men from David, so hopefully some of that was caught on video somewhere that we can share later. All right, so we've been here for a few days. A lot of us are gathered together. Over 1,000 of us working in the sector of STI prevention. We've covered a lot of topics. We've talked about syphilis and congenital syphilis, doxypep, and we were fortunate enough to see the final guidelines released yesterday from CDC. And we've also discussed preventing future mpox outbreaks. Last year, I was fortunate enough to be here during the closing plenary and talk a little bit about adolescent health and some challenges that are facing our adolescent communities. I talked about some policies that were hindering their autonomy and their ability to make informed decisions about their own health. Unfortunately, things have not gotten much better, and in a lot of parts of this country, they've gotten a little bit worse. We're all acutely aware that young people continue to experience half of the STIs in the US. And I think we're also aware that there's no way out of these epidemics if we fail to serve young people. So, we're starting off the session today. We've called this, It's Time for a Wake-Up Call. I hope you all will join me in ushering in this session and welcoming our esteemed presenters as we dive into this topic a little bit more. Thank you.
Please welcome Director of the CDC's Division of Adolescent and School Health, Dr. Kathleen Ethier.
Good morning, everybody. And it's so great actually to not see any of you. I can't see a single one of you, but I know you're there. I can hear you. Thanks for getting up so early in the morning and coming to hear what we really want to tell you about not just the crisis or the crises that we face in adolescent health in this country right now, but solutions. I would really love to talk to you about solutions and to get you thinking about how you can take what we've been working on toward those solutions back to your jurisdictions and back to really a focus on how we can improve the lives of the young people in this country. At CDC, in the Division of Adolescent and School Health, we really focus on schools. And the reason that we do that is because, really at the intersection of public health and education is the ability to change the lives of every young person in this country. And so we do that kind of at 3 levels. At a national level, we focus on kind of tools and resources and technical assistance that any school district in the country can use in order to improve adolescent health. At the state level, we know that what states can do is to really put policies and practice guidelines in place so that the schools in their state are able to do the work that we want them to do. But we also really know that what happens in a school, is determined by the policies and practices put in place by individual school districts. And so I'm going to really talk to you this morning about what we're doing with local school districts so that you can get ideas, whether you work at the local level, whether you work at the state level or the national level, about what you could do to help local school districts put these efforts in place. So supporting adolescent health and well-being in schools requires three really important things to be in place in schools. First, we know that when students have access to quality health education, particularly sex education, it gives them the knowledge and the tools that they need to make good decisions. But that's not enough. We also know that they need to have access to quality health services, including sexual health services. And I know that that's something that many of you in this room work on. Third, we also know that their school environments need to be safe and supportive. And I'm going to talk a little bit more in depth about these three things. But at CDC, we've put those three strategies together into a program that we call What Works in Schools. And we've been working on this program for a number of years and have evaluated the impact of that program. And we know that when schools put quality health education in place, increase access to health services, and create safe and supportive school environments, a whole range of things improve at the population level in schools. So we know that sexual risk behaviors decrease, we know that substance use decreases, we know that experience of violence, including sexual violence, decreases for the students in those schools. We know that mental health improves, and we know that suicidal thoughts and behaviors decrease. Those outcomes really kind of encapsulate much of what we know to be the crisis in adolescent health in this country. And so what this means is that we have a program that works to improve broadly all of those aspects of adolescent health. So let me talk about each of them individually. Health education, which is an increasing challenge for many school districts to put into place, particularly sex education, needs to be medically accurate, it needs to be developmentally appropriate, and can start even in elementary school, needs to be culturally inclusive, and needs to really build knowledge and skills. We know that the ability for schools to put sex education in place continues to be at risk. So for instance, this is data from our school health profiles, which if you don't know about school, I know we're pretty famous for YRBS, but we also have a system called school health profiles that tells us kind of nationally and at the state level what policies and practices around health are being put in place in middle schools and high schools. And so what we know from this data is that although 89% of secondary schools, which are middle schools and high schools, required health education in grades 6 through 12, only 24% of schools nationwide taught all of the sexual health topics in grades 6 through 8 that we would like them to, and only 45% of high schools taught all the key sexual health topics that we would like for them to. But I want to give you an example of one district that's really making important strides in this area. So, for instance, Boston Public Schools really focused on 4th through 6th grade students. The reason they did that is because that's the ages where young people start to understand their bodies, are curious about their bodies, and need to know before they get into adolescence, before they go through puberty, what they need to know about how their bodies work. And so Boston Public Schools really expanded their health education in a set of 16 schools. They hired additional part-time health education teachers. They provided curriculum, resources, and professional development to all these schools, and really engaged families in being both approving curriculum and being engaged in what was taught. They made great strides and were able to serve more than 2,000 students in those schools. And so we know that when there is concerted effort made, even at younger ages, to put health education in place, it can be done. So let's talk about health services. What is important about schools and health services, first, it's challenging. I think that's one of the things that we've learned is that both incorporating health services into schools, either through school-based health centers or through school nursing programs, or getting students out into communities and access to good health services is really challenging for schools. But we know that it is an important access point, and we also know that students need to be connected with services that are non-stigmatizing, are confidential, which is very challenging, accessible, and youth-friendly. What we've learned through our data is that, as I said, this is extremely challenging for schools. So only 10% of secondary schools nationwide provide at least one key sexual health service to all students. And less than 40% of secondary schools nationwide provided referrals to at least one key sexual health service to students. I think for those of you, especially those who work in health departments and across the country, I think this is really a place that you can be helpful. Reach out to your local school districts, reach out to your departments of education in your states to talk to them about how you can help them improve access to health services in the country. We had one really great example in San Francisco. The San Francisco Unified School District created wellness centers in some of their middle schools. And they didn't just focus on sexual health education, they also focused on mental health support, counseling, did things like provided condoms and referrals to community clinics. These have been incredibly successful, and in just the first couple of years of having these wellness centers in place, they've really seen improvements in both what students know and what students do. So the last area that I want to talk about this morning is really, it's one of those areas where it's less specifically focused on health, but what we have seen in our schools and in our research is that when students feel engaged and connected in their schools, they do better and they feel better. So there is really power in increasing students' feelings of what we call connectedness. I think we all learned during the pandemic that as humans, we don't do well being isolated. And one of the impacts of school closures during the pandemic was this sense of isolation for young people. Now, students are back in school, and we know all of the ways in which we can help young people feel reconnected. Making sure that teachers have really good training on classroom management, on how to really support students in their behavioral and their mental health in their classrooms, and making sure that classrooms are safe. Linking young people to programs either in schools or in their communities to engage them in community service work, to bring mentors into schools is an incredibly effective way of improving connectedness. And implementing policies and practices that support LGBTQ youth, including having gender and sexuality alliances, professional development for educators on the importance of inclusivity, identifying safe spaces. And we know that when schools do those things, the mental and behavioral health both of LGBTQ students as well as students who identify as heterosexual improves. We know that when young people feel connected and engaged in their schools, they not only do better and feel better during adolescence, but 20 years later. So young people who said that they felt a stronger sense of school connectedness in 7th through 12th grades, when they were in their late 20s and early 30s, not only did they have better mental health, they were less likely to have ever had an STD. And I know that's why we're all here. So when we talk about things like school connectedness, I know it feels kind of squishy, but it really is one of those things that has this long-term impact. And as I said, we know that when schools do these things, young people feel more connected, and we see positive outcomes. However, as we've seen over the past several years, in particular, making sure that schools are inclusive for LGBTQ students is increasingly difficult. There we go. So, for instance, although 87% of secondary schools identified safe spaces where LGBTQ students can receive support from administrators, teachers, and other school staff. Only 31% of secondary schools nationwide provided any kind of professional development for school staff on supporting LGBTQ students. And less than half of secondary schools nationwide had a GSA. The research on the importance of GSAs is long-standing, and so that we see less than half of schools supporting students in that way is of great concern. And yet, there are great examples all over the country. This one happens to be from Florida, from Hillsborough County. And in an effort to create safer and more inclusive learning environments, Hillsborough County Public Schools trained 140 school staff members on the importance of addressing harassment of LGBTQ students to create safer and more supportive learning environments. So I'm going to stop there and we're going to have some conversation. My call to action for you all is this. We know it works. We have the tools to support our young people. We must support our schools in using those tools. And I would love to continue the conversation about what you all can do when you go back to your jurisdictions to support schools in making the changes that we need to see in order to improve the health and well-being of our young people. I personally can't think of many things that are of greater importance. This is our future. And so thank you all so much for being here. Thank you for your interest and attention to this issue, and really happy to continue this conversation. So thank you so much.
Please welcome, from the Health and Human Services Office of Population Affairs, Jacqueline Ruiz.
Hi, everyone. I feel like Kathleen did a wonderful job setting me up, because today we are going to talk about how the Office of Population Affairs has a new initiative for adolescent health called Take Action for Adolescents, a call to action for adolescent health and well-being, which we launched just last fall. There we go. Okay. So OPA worked closely with more than 150 youth and young adults, or adult experts, to build Take Action for Adolescents, a call to action for adolescent health and well-being. Take Action for Adolescents is designed to promote, improve, and sustain collaborations that will lead to meaningful investments in adolescent health and well-being. Our partners included folks from local, state, and federal agencies, as well as many others, as well as researchers, advocates, clinicians, and staff from national and community-based youth-serving organizations. We had a youth town hall in May of 2023 with a diverse group of 14 young people from across the US, and we involved young people in reviewing, finalizing, and launching Take Action for Adolescents in both international and domestic forums in October of 2023. Take Action for Adolescents is built on a strong foundation of research and a set of key cross-cutting principles. These principles include full and timely access to health and social services, agency so that young people can make or influence decisions about their lives and set their own goals, health equity, meaningful youth engagement, positive youth development, which we define as building on young people's strengths and potential rather than seeing them as a collection of problems to be solved, quality in healthcare and social services, and taking a whole person approach that addresses all of the complex aspects of a young person's life rather than simply focusing on individual behaviors, diagnoses, or symptoms. Using these key principles that I just mentioned, Take Action for Adolescents outlines 8 goals designed to empower all adolescents to be well and thrive. You see the goals on these slides. Goal 1, eliminate disparities to advance health equity. Goal 2, increase youth agency and youth engagement. Goal 3, ensure access to safe and supportive environments. Goal 4, expand access to health and social services. Goal 5, increase system coordination and collaboration within and across systems. Goal 6, strengthen training and support for caring adults. Goal 7, improve health information and health literacy. Goal 8, support, translate, and disseminate research. To help communities imagine what progress toward goals could look like, Take Action for Adolescents offers some sample action steps for various groups, including policymakers, health and human service providers, youth-serving professionals and organizations, researchers, and parents and caregivers. Take Action for Adolescents and its action steps are meant to be a starting point for further brainstorming, cooperation, and collaboration across disciplines and youth-serving sectors, and for use at different levels of government and community that affect young people. They're intended to inspire everyone who cares about young people to take action that they have a healthy future. Sorry about that. Oh, go back one more. Sorry. So since we launched last October, we have taken Take Action for Adolescents on the road. We've done several virtual and in-person trainings and presentations for our federal colleagues and external organizations. And we facilitated some community dialogues on Take Action for Adolescents in Boise, Idaho, Salt Lake City, Utah, San Antonio, Texas, St. Louis, Missouri, and Minneapolis, Minnesota. The goal of these activities is to help our adult and youth allies and partners in multiple youth-serving sectors reflect on how Take Action for Adolescents relates to their work and identify steps they can take to utilize it effectively in their organizations and communities. So just an example of one of these events that we held, in Minneapolis, it was a 2-hour workshop. And by no means was this workshop intended to be a one and done. We solved all the problems that were happening in Minneapolis, but really just the start of a collaborative conversation among diverse stakeholders in Minneapolis. In this conversation, you'll see the partners that were involved, which included youth as well as local stakeholders in Minneapolis. And they identified some key priorities for themselves aligned with the Take Action for Adolescent goals and principles. So some of the themes of what we heard was a strong conversation or a strong theme around racial equity and the need for the voices of communities of color to be included and heard when talking about adolescent health and well-being. Young people wanted to be seen as equal partners and don't appreciate the power imbalance that is presented at times by adults. I was very just amazed at all that Minneapolis has to offer their young people in terms of supports and services. But unfortunately, there seemed to be very little awareness of all these resources that are available. And so the organizations talked about the need to go out into the community, talk about their programs and services, involve young people in this promotion and dissemination of these efforts, not only in social media, but also as individuals out there in the community talking about it. And really involving frontline staff. So for example, teachers who are crucial in getting information out about what programs and services are available in the community. They talked about the need to invest in young people as well, such as offering internships, fellowships, job opportunities to get them passionate about this work and set up the next generation of youth-serving professionals. And what they talked about was the need to see from funders more opportunities that allow them to collaborate in a meaningful way and not feel like they have to compete over resources, as well as seeing programs that take a more strength-based approach instead of focusing on deficits. Take Action for Adolescents has a lot of great content for communities to use, and we know that it covers a lot of ground. And so for this reason, we developed the Take Action Toolkit, which helps communities that are ready to use Take Action for Adolescents to create their own plans. It provides tools for a community assessment, selecting and crafting action steps, and creating partnerships with defined roles. You can access these resources using the QR code that you see on the screen, the call to action, the Take Action Toolkit, and a 2-page document that summarizes the call to action are available both in English and Spanish on the OPA website. And on the website, you'll also find sample social media posts that are easy to download, customize, and share as well. So we know that there's still a lot to learn about the best ways to support adolescent health, and Kathleen talked a little bit about what they've already learned at the CDC. We're also working closely with youth and adult experts to craft an adolescent health research agenda to strengthen our knowledge base and inform programs, activities, services, and supports for young people going forward. This involves convening youth and adult experts in adolescent health to help us identify research gaps and innovative research methods. We also plan to actively involve young people in the design, translation, and dissemination of research that concerns them. And we're collaborating with our colleagues inside and outside of government and from across the US in this effort, just as we did in crafting Take Action for Adolescents. And we hope to have an agenda completed this fall. So a brief highlight of the ways that we are taking action at the Office of Population Affairs to support adolescent health includes celebrating National Adolescent Health Month, which was just last month. This year, we focused on Take Action for Adolescents and provided federal resources linked to Take Action for Adolescents' 8 goals, a weekly newsletter, shareable social media posts and graphics. And new this year, we also had a youth-facilitated dialogue about how communities should support adolescent health. Our office also funds the Title X Family Planning Program and the Teen Pregnancy Prevention Program. The Title X Family Planning Program serves as a critical safety net to make sure everyone has access to high-quality, accessible family planning services, including adolescents. Title X recipients provide confidential, adolescent-friendly health services. And then the Teen Pregnancy Prevention Program is a national evidence-based program that funds diverse organizations working to give adolescents and the adults supporting them the tools and knowledge to improve sexual and reproductive health outcomes and promote positive experiences, relationships, and environments to help our nation's youth thrive. So we hope that you'll check out our website where you can sign up for our e-newsletter, find our different social media accounts, learn about all of our programs and activities. There's a URL and a QR code that'll take you to the Take Action for Adolescents landing page, where again, you can download all the resources that are available. And I just want to thank you all so much for allowing me the opportunity to share about our work and these resources. And we hope that you'll join us in taking action for adolescents.
Please welcome back to the stage Dr. Kathleen Ethier and George Walton.
All right. Thank you both, Jacqueline and Dr. Ethier, for your comments and for helping us further this conversation. It's clearly a topic that we all care very deeply about, and for that reason, I'd like to dive in a little bit deeper here with some more questions. All right. First off, we know we've seen some big political and cultural shifts over the past few years. It's put a magnifying glass on schools and public health. That's a shared experience for a lot of people in this room. What have you seen happen with these shifts, and how does it impact our collective capacity to support young people? And Dr. Ethier, I'll let you start.
Yeah, thank you. Obviously, to take apart any particular law or policy is probably not my role, but what I will say is that I do think the pandemic has focused us on schools and the role of schools in ways that I have not seen before in all of the years that I've been doing this work. And I think there is positives and negatives to that. I think when I've been out and, for instance, talking to district leaders, superintendents, and I ask them how much of a priority is health and well-being, mental and behavioral health, so including sexual health, how much of a priority is that for you now? It's in the top 3, and for many, it's the top priority. And I think we've seen a shift in important ways in the degree to which health and well-being are being incorporated into the school environment, and that is absolutely positive. On the other side, I think that there are some policies and practices that are not supportive, or there's been the removal of practices that are supportive. And I think that concerns me a great deal. And so, what we try to do, and I hope what all of you can try to do, is to advocate for the things we know are important for young people to have and in their schools. And that is their safety, their well-being, teachers and school staff who support all young people in a school, but particularly the most vulnerable, and in ways that we know have strong evidence to support them. And I think if we can continue to move and push in those areas, we will see improvements.
Okay, thank you. Jacqueline, what are your thoughts on what we've seen with these shifts and how it affects us?
Yeah, so I would agree. I mean, what we see is it just varies so differently on where you are in this country. The demands on schools, the demands on public health officials. And I think what is the unifying factor in all of it is just really the need to collaborate. I think we see a lot where folks are feeling overwhelmed by the responsibility of taking it all on their own, and knowing that there's probably really great partners and resources that exist in your community, and it's about fostering those relationships and creating those collaborations, because never can one entity do all of it, right? And so I think, like Kathleen mentioned, like reaching out to the schools, I would only assume that they would be overjoyed to find somebody who would be willing to take something off their plate to work with them. And there's a lot of great resources out there. So I would just say a lot around collaboration and partnerships and coordination is just as important as ever nowadays.
Okay, thank you. All right, one experience so many of us in this room have had is using language about overall health, not necessarily as a statement of shared values or the importance of overall health, but sometimes as a strategic way to erase sexual health from our public-facing language, especially around youth. DASH and OPA have recently developed new programming that focuses on broader adolescent health, especially mental, physical, and behavioral health efforts. So as your federal programs are talking about, these broader health issues, how does sexual health fit into that? And taking it a step further, how can you assure, folks in our audience who work with youth that sexual health needs will remain at the forefront? Jacqueline, would you like to start us off?
Yeah, so the Take Action for Adolescents, the presentation that I just did, is a new initiative for us. I'm gonna give like a little history lesson. So I wanna say 2018 or 2019, I can't remember. Pre-COVID, I just feel like it's all one gigantic era. The Office of Adolescent Health, which used to run the Teen Pregnancy Prevention Program, merged with the Office of Population Affairs. And so with that merge came the statutory authority to coordinate and advise on adolescent health issues, which is where Take Action for Adolescents comes from. It's sort of that authority spurred us to develop this initiative. And so as part of that, we were very intentional because I do think it's not adolescent sexual reproductive health or adolescent health well-being. I think it's adolescent health well-being where sexual, as Kathleen mentioned in your presentation, sexual reproductive health is a component of it, but you can't have positive reproductive health outcomes or sexual health outcomes if you're not also addressing mental health or substance use or other issues that youth are facing. And so that's how we see our initiative for Take Action. However, our office also remains highly committed to sexual reproductive health. We have Title X family planning services where we are invested in providing confidential adolescent-friendly services, the Teen Pregnancy Prevention Program, that latest grant program and their notice of funding opportunity talked about adolescent health and well-being, but specifically noted the need to connect youth to sexual reproductive health services, realizing that they account for half of STIs in this country, and they really need to be connected to services to help with those outcomes.
Thank you for that. Dr. Ethier, what are your thoughts?
Yeah, so when I first got to DASH, going on 8 years ago now, our sole focus was on sexual behavior and sexual health outcomes. And what we learned in evaluating our programmatic work was that the program had this really broad impact, and that it didn't really make sense to isolate sexual behavior outside of kind of a range of behavioral health issues. Then when we have been looking at, in our WIRE-BS data, changes nationally in what the data looks like, we keep seeing these decreases in the proportion of young people who say that they're having sex. We keep also seeing decreases in protective sexual behaviors,